I would like to discuss about hypoglycemia, the most common emergency situation. Normally happened for most of the people. So hypoglycemia is the blood sugar level getting lower than the normal. So before get into the treatment of hypoglycemia, just I would like to show this image. You can see the blood vessels having low blood glucose and high blood glucose. So when the blood glucose is not normal, the pancreas will secrete two hormones. One is glucagon and another is insulin. Glucagon from alpha cells of pancreas, insulin from beta cells of pancreas. So these hormones normally released when the blood glucose level is abnormal. When the blood glucose is lower than the normal, that means the normal blood glucose is around 140 milligram per deciliter. So that is 140 is the normal limit. So when it is less than the normal, the glucagon is released from the pancreas. Then the liver release the glucose into blood. So it will make the blood sugar normal. If it is high, the glucose or sugar level is high, insulin will be released from the pancreas. In this case, the fat cells take the glucose from the blood. Then again it will make sure the normal blood glucose level. If the blood glucose level lower than the normal, that means less than 140, that shows the hypoglycemia. If it is more than 140, if it is more than 140, nearly 200, it shows the hyperglycemia. So get into the point. Hypoglycemia is a condition of lower than the normal blood glucose. It's around 50 to 54 milligram per deciliter. So normal level is 140 milligram per deciliter. If the level nearly 50 to 54, that shows the hypoglycemic symptoms. If it is around 100, you may not observe any symptoms and any manifestations. If the level is around 50 to 54 milligram per deciliter, shows the hypoglycemic symptoms. That is often emergency. So we need to treat carefully, or we need to manage very carefully. So hypoglycemic symptoms and manifestations can be divided into three types based on the hormones and the effect. First of all, we may encounter the regulatory hormones like epinephrine or adrenaline. So it may show the adrenaline based symptoms, and there is another case is the glucagon based symptoms. We may categorize into two: adrenaline based and glucagon based symptoms triggered by falling glucose. Then another symptoms, that is neuroglycophenic effect. Neuroglycophenic symptoms, that is produced by reduced blood brain sugar. So you can see the image showing the normal blood glucose. This is a lower, called hypoglycemia. If it is higher blood glucose than the normal, called hyperglycemia. If the level is more than 200 milligram per deciliter, it's called diabetes mellitus. Diabetes mellitus is not an emergency situation, but this lower blood sugar, hypoglycemia, is the emergency situation. We need to treat carefully. In the case of adrenergic manifestations, adrenergic symptoms observed during the hypoglycemia, the level nearly 50 milligram per deciliter, that shows the following adrenergic symptoms like shakiness, anxiety, nervousness, palpitations, tachycardia. Palpitation means irregular heartbeat. Tachycardia means excess or over heartbeat, fast heartbeat than the normal. Sweating and feeling of warmth. So feeling of warmth normally that is based on the sweat gland in the muscarinic receptors. It's one of the adrenergic manifestation is not surely accurate, but mainly sweating will be there. Sweating will be there. Pallor, coldness or calmness. Dilated pupils, mydriasis in the eyes. Feeling of numbness. That means pins and needles. That is paresthesia. Paresthesia. These are the adrenergic manifestations. Then another is the glucagon mediated symptoms include hunger, boredom, nausea, vomiting, abdominal discomfort, headache. So you can see these are the symptoms normally associated with the hypoglycemic situation. In the case of neuroglycopenic symptoms, includes abnormal mentation, impaired judgment, personality change, emotional liability, fatigue, weakness, apathy, lethargy, daydreaming, sleep, and confusion, amnesia, dizziness, delirium, stupor, coma, abnormal breathing, generalized or focal seizures. So these are the neuroglycopenic symptoms. So we categorized symptoms into three. One is adrenergic manifestations, glucagon manifestations, and neuroglycopenic manifestations. In the case of causes of hypoglycemia, so causes may be different based on the person to person. So we need to do or inquire based on the circumstances that include age of the patient, time of day, time since last meal, previous episodes, nutritional status, physical and mental development. And the other causes include drugs or toxins, especially insulin or other diabetes drugs, any other oral hypoglycemic agents. Then any case of any disease of other organ system. Then family history and response to the treatment. So these are the common causes associated with the hypoglycemia. In the case of management of hypoglycemia, I have categorized into two: management for conscious patients and management for unconscious patients. So management for conscious patients, it is very simple. We may manage with quickly take a glass of sugary rich drink. We may take a glass of sugary rich drink or eat 1 tablespoon of sugar. So we may take sugary rich drink or we may take sugar or honey and have a meal followed by a meal. If symptoms persist after 5 minutes, repeat the same. So managing the hypoglycemic patients in emergency case, in the conscious patients, just taking a sugar content drink or directly we can take a sugar or honey or we may take a meal. So by the way, by the time we may manage the hypoglycemic patient for in the conscious state. In the case of management of unconscious patient, unconscious hypoglycemic patients, you may go with some different category. For example, normally intravenous infusion of 50% of glucose bolus, around 40 to 50 ml. So this is what the normal treatment for unconscious patients. IV infusion of 50% of glucose, 40 to 50 ml, or 100 to 150 ml of 20% dextrose, followed by 8 to 10% of glucose if necessary. So this is the IV treatment if the patient is unconscious. Otherwise, we may give glucagon injections. We may administer 1 milligram glucagon injection intramuscularly or subcutaneously. If this is not available, we may go with glucagon injections. In the case, the hypoglycemia is prolonged illness due to the long-acting sulfonylureas or any long or intermediate acting insulin or alcohol. So in this case of any long-acting oral hypoglycemic drugs, if the hypoglycemia is prolonged in nature, we may go with prolonged IV dextrose infusion. That means less concentration, 5 to 10% for 12 to 24 hours. In case if IV access is impossible, we may consider nasogastric tube or rectal glucose. So upon the recovery, we may give long-acting carbohydrate snacks. So this is the treatment for conscious patient and unconscious hypoglycemic patients. If you like this content, please do subscribe my channel